Tonight, pay close attention to how you sleep. Your health could depend on it. Noticing a symptom early doesn't automatically mean you have a serious illness. It simply gives you the chance to speak with a healthcare professional before a potential problem becomes harder to manage. Many health conditions are easier to address when they are identified early. Changes in your sleep can sometimes reveal warning signs that deserve attention. One symptom that should never be ignored is waking up suddenly, gasping for air while there are many possible explanations. Recognizing the pattern and discussing it with your healthcare provider can help determine whether further evaluation is needed. Today we'll look at 15 commonly overlooked symptoms that may affect adults over 75 and explain why understanding them can support healthier aging. Point 1. If you frequently wake up feeling short of breath, pay attention to whether you also experience loud snoring, morning headaches, or excessive daytime fatigue. These details can help your healthcare provider better understand what may be occurring. Point 2. Loud snoring followed by several seconds of complete silence may indicate temporary pauses in breathing during sleep. This pattern should be evaluated by a healthcare professional. Point 3. Frequent morning headaches may seem harmless, but when they occur alongside loud snoring or nighttime breathing difficulties, they could be linked to poor sleep quality. Because many conditions can cause morning headaches, persistent symptoms should always be discussed with a healthcare provider. Point 4. Feeling unusually sleepy throughout the day is not always a normal part of aging. If you regularly doze off while reading, watching television, or sitting quietly, your sleep may not be as restorative as it should be. Repeated nighttime breathing interruptions can leave you exhausted, even after spending many hours in bed. Point 5. Waking up with a dry mouth every morning is another symptom worth mentioning to your healthcare provider. Although dehydration, medications, and other factors may contribute, mouth breathing during sleep is another possible cause. When dry mouth occurs, alongside loud snoring or gasping for air, it may provide another clue that your sleep needs closer attention. Point 6. Many older adults overlook episodes of waking up with a racing heart because the sensation often disappears within minutes. It is easy to ignore. In some cases, the body may briefly awaken itself when breathing becomes disrupted during sleep, however. Heart rhythm disorders, anxiety, medications, and other medical conditions can also cause similar symptoms. Instead of assuming the cause, pay attention to how often it happens and whether it is accompanied by dizziness, chest discomfort, fainting, or severe shortness of breath. Your healthcare provider may recommend additional testing to identify the underlying reason. Point 7. Needing multiple pillows just to breathe comfortably while sleeping is another symptom that should not be ignored. Some older adults notice that breathing becomes more difficult when lying flat and improves when sitting upright. This can be associated with several conditions, including heart or lung problems. If you repeatedly wake up gasping for air after lying flat, make note of the pattern and discuss it with your healthcare provider. If breathing difficulty becomes sudden or severe, seek emergency medical attention immediately. Point 8. Frequent nighttime trips to the bathroom may seem unrelated to sleep, but some people with untreated sleep apnea experience increased nighttime urination. Because many conditions can cause symptom, persistent changes should be properly evaluated. Point 9. Difficulty concentrating or increased forgetfulness may sometimes be connected to poor sleep quality. Repeated sleep interruptions can prevent the brain from getting the restorative rest it needs. Persistent memory or concentration problems deserve medical evaluation. Point 10. Mood changes, including irritability, anxiety, or a lack of motivation, may also develop when sleep quality remains poor over time. While many factors can affect mood, discussing ongoing symptoms with a healthcare professional may help identify contributing causes. Point 11. Some older adults assume that if they can still function during the day, their sleep problems cannot be serious. Unfortunately, many people gradually adapt to poor sleep and begin accepting constant fatigue, reduced energy, and slower thinking as normal. Fortunately, many sleep-related breathing disorders can be diagnosed and treated. Depending on the cause, treatment may include lifestyle changes, weight management, sleeping position adjustments, oral appliances, or a sleep study to determine whether therapies such as CPAP may be beneficial. Point 12. Family members often notice sleep-related symptoms before the person experiencing them does. A spouse, caregiver, or relative may observe loud snoring, breathing pauses, choking sounds, or sudden gasping during the night. If someone close to you expresses concern about your breathing while sleeping, take their observations seriously and share them with your healthcare provider. Point 13. One of the most common mistakes older adults make is assuming that every new symptom is simply part of aging. While sleep patterns naturally change with age, repeatedly waking up unable to breathe, feeling exhausted every day, or being told that you stop breathing during sleep are not considered normal aspects of healthy aging. Early evaluation does not mean something serious is definitely wrong. It simply provides the opportunity to identify treatable conditions before they begin affecting overall health. Point 14. Ignoring sleep. Related symptoms can impact more than just your nights. Poor sleep quality has been associated with reduced concentration, slower reaction times, and an increased risk of falls in older adults. It may also make managing existing health conditions more difficult. Many people experience meaningful improvements after receiving an accurate diagnosis and following an appropriate treatment plan. Point 15. Even after age 75, your body continues sending important signals. Symptoms such as waking up, gasping for air, loud snoring, persistent daytime fatigue, or frequent morning headaches deserve attention. If you notice one or more of these symptoms, consider discussing them with your healthcare provider. And if you ever experience severe breathing difficulty, chest pain, fainting, confusion, or blue lips or fingertips, seek emergency medical care immediately. Listening to your body's warning signs today may help you enjoy healthier, safer, and more restful years ahead. Another symptom that often goes unnoticed is waking up repeatedly throughout the night without knowing why. Some older adults assume these awakenings are simply part of getting older, but frequent sleep interruptions may indicate that the body is repeatedly responding to breathing disturbances. Even if you fall back asleep quickly, these repeated awakenings can prevent deep restorative sleep and leave you feeling tired the next day. Point 17. Night sweats that occur regularly may also deserve attention, especially when they happen alongside loud snoring, gasping for air, or frequent awakenings. While many conditions can contribute to nighttime sweating, repeated breathing difficulties during sleep may sometimes place extra stress on the body. If night sweats become persistent or are accompanied by other concerning symptoms, discussing them with your healthcare provider can help determine whether further evaluation is needed.